February is American Heart Month, and my guest this morning here on Jersey Magazine is Dr. Clyde Yancy. He's the chief cardiology at Northwestern Medicine Cardiovascular Institute. Dr. Yancy, we hear the term heart disease all the time. What exactly is it?
Well, Jim, good morning, and thank you for hosting this conversation. We should all be aware of heart disease and understand that we don't have to experience it first. But heart disease is any condition where the heart and blood vessels are no longer functioning normally. When that happens, Jim, it puts us at risk for things that we'd wish to avoid, like strokes, like heart attacks, like heart failure, like irregular heart rhythms. But rather than think about the diseases, think about ways that we can avoid that.
Now, some of these, you talk about being able to avoid it, but some of this is stuff that you're born with, which is a whole different topic.
So that is correct to a point. It turns out that about 80% of all heart conditions are absolutely preventable. I'll say that again. Jim, 80% of all heart conditions are preventable. Yes, we do inherit tendencies from our family. And yes, there are some specific conditions which really are driven by genetics. But for the everyday listener who's thinking about this conversation, 80% of heart conditions are preventable. That's why this conversation is so important.
I would imagine that not smoking and controlling your weight are two ways of dealing with this and preventative measures. What are some other things that listeners can do, Dr. Yancy?
So let's call that the generic information. Don't smoke, eat a heart-healthy diet, control your weight. But let's take it to the next level. What are the positive things we can do? Rather than talking about don't do this, don't do that, what are the positive things? Let's think about being more active, getting up and moving. Moving feels good. Exercise is a good thing. If exercise was a drug, we'd all take it 3 times a day. Let's get up and move. That's a very positive thing. Let's eat the foods we enjoy. Let me say that again. Let's eat the foods we enjoy, but let's practice active portion control. Just eat a little bit less. If we do more, eat less, and then guess what? If we learn about our bodies, if we learn our numbers, know your blood pressure, know your cholesterol, even know your hemoglobin A1C. It's amazing when we have the power of information, what we can do in a very positive way. So the traditional stuff is still important, Jim, but let's think about these new dynamics of the positive things we can do.
How did COVID affect all of this in terms of heart disease, Dr. Yancy?
COVID was a tragedy in every sense of the word, but the one thing that we do recognize is that COVID made us all understand the preciousness of our health, the importance of preserving our health, and we understood that there are steps we can individually take. The word is by our volition that will help us preserve our health. And so we can take that lesson learned from the COVID experience and bring it into the heart disease experience, where once again, we take control of our health. And we do that by being proactive and taking preventive steps.
You mentioned talking about taking preventative steps and that there are many things that we can do, yet heart disease is the #1 cause of death in the United States. Why do you think that is?
Heart disease is so ubiquitous because our lifestyle is so universal. We all follow mostly the same diet, the same activity profiles. Rather than think about how deadly heart disease is, let's think about what's the opportunity here. If we change the frame and think about how we can make different choices, how we can still enjoy life and living, but do it in moderation, do it more carefully, then we don't have to be intimidated by this issue of heart disease and death.
You mentioned, everything in moderation. I've been doing my best, as we have here at the start of the new year, to avoid fast food. And I finally had to break down last night. I was in a situation where I just had to. So there I was with the quarter pounder with cheese.
But that's the whole point of moderation. It would be difficult to say, I'm just going to rigorously avoid carbohydrates and fast foods and French fries and all of those sort of things. But if one thinks about moderation, if one allows yourself to have a celebratory day, the things that you most enjoy, as long as it's part of an overall, overarching healthy profile, let's be positive and think about the things we can do, think about the things we can enjoy. There's no reason to limit ourselves. Just understand moderation.
Why are Black Americans and women at an increased risk of heart disease, Dr. Yancy?
So this is an incredibly important conversation. I want to be very clear, particularly for women. We have to raise the awareness across the board within women themselves to understand that they do carry risk for heart disease. And for people like me, cardiologists and doctors that take care of women, to realize that women are at risk for disease in the same way. And we should no longer partition this as men have certain risk and women have certain risk. And particularly for African Americans and especially African American women, the ubiquity, that is the prevalence or the likelihood of high blood pressure, obesity, and diabetes, that trio is deadly. And I will use that word right now. High blood pressure, obesity, and diabetes, especially as it affects Black Americans, that's a deadly mix. We need to understand that and do things proactively to prevent those things from having consequences.
And as you've been saying all along, a lot of this is preventative, depending upon the lifestyle that we live.
And it's easy. People think that's impossible, but it's not impossible. Be a little bit more active. Eat a little bit less. Be proactive. Know your numbers. And there's one more thing. There are four pillars here that I'm going to tell you. Do more, eat less, know your numbers, especially your blood pressure, and get more rest. I said before that if exercise was a drug, I'd take it 3 times a day. If sleep was a drug, I would take it all night long.
Dr. Yancey, for our listeners who want to learn more, where can they go?
Go to nm.org/heart or go to the American Heart Association website. I'm a volunteer there. It's great information in both places.
And again, that is nm.org/heart. February, American Heart Month. Dr. Clyde Yancy, thank you so much for joining us this morning here on Jersey Magazine.
So glad you're interested. Thank you so much.